Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. This week, CMS announced a new value-based model for Medicare Part B, which covers prescription drugs administered in a doctor's office or a hospital, such as cancer medications and eye care treatments. Right now, providers are paid 6% above the sales price. The proposed model would pay 2.5% plus a fee of $16.80 per drug per day. CMS wants to study whether this change alters prescribing habits. The proposal offers other models, including eliminating patient cost sharing, payments that are tied to indications, which means drugs would get higher reimbursement if they work better for certain conditions, and risk-sharing agreements with drug manufacturers. Reaction from cancer providers was swift and harsh. Dr. Alan Lichter, CEO of the American Society of Clinical Oncology, said in a statement, ASCO believes that it is inappropriate for CMS to manipulate choice of treatment for cancer patients using heavy-handed reimbursement techniques. The Medicare Part B proposal was a topic of conversation at this week's conference of America's health insurance plans. Dr. Tricia Newman of the Kaiser Family Foundation spoke with AJMC about whether drug prices would come down if Medicare used its negotiating power, as presidential candidates have proposed.
In the past, the Congressional Budget Office has looked at this idea of government negotiations, and their view is that it might have a negligible effect on spending unless the proposal has real teeth, which is to say the government would set a formulary, the government would decide what the cost sharing would be, and probably, and most importantly, the government would be willing to walk away from the table if they couldn't get a better drug price from the pharmaceutical companies.
A new study from AHIP, published by the American Journal of Managed Care, finds that whether care happens in a hospital has major effect on the cost, and the migration of care into the hospital is driving up spending. The study found that price variation led to $1.9 billion in additional spending on 7 common medical services in 2013. Among the key findings, in 2013, the price of a routine office visit was 21% higher if it took place in a hospital outpatient department instead of a doctor's office. A chest radiography was 258% higher in the hospital than if performed in a doctor's office. That increase in price variation, along with a shift in services moving into hospitals, raised total health spending 44% from 2008 to 2013. For the full study, visit ajmc.com. This week, Novo Nordisk announced top-line results for a 5-year study of Victoza, the version of liraglutide approved for patients with type 2 diabetes. Results from a long-term cardiovascular outcomes trial of 9,000 patients showed the drug reduced the risk of major adverse cardiovascular events. As the FDA has required these extended safety trials in recent years, results help distinguish diabetes and obesity drugs from one another. Full trial results will be presented in June at the 76th Scientific Sessions of the American Diabetes Association. And there's still time to register for patient-centered diabetes care, which meets April 7th and 8th in Teaneck, New Jersey. For more information, visit ajmc.com. For everyone at the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.